Tendon injuries are very common and account for about 30% of all musculoskeletal consultations. Runners on average have an annual incidence of 7 to 9% for Achilles tendinopathy, whereas basketball and volleyball players have a higher incidence of patellar tendinopathy. So depending on the sport or activity you do, you may be at more risk for certain areas of injury with tendons. Tendons are structures that connect muscle to bone. They help to transmit the force that's generated from muscle contraction to the bone to help produce movement. They also absorb external forces to prevent muscle overloading, and they help with temporary energy storage. For example, during jumping, the patellar tendon has load storage before the jump, and then it helps absorb forces on the landing of the jump. Tendons are connective tissue that are made up of type 1 collagen, which are bunched into fascicles, and they create a high tensile strength of the tendon, so it kind of acts like an elastic. This kind of looks like raw spaghetti, and then if you have a tendon injury, then this ends up changing the structure of the tendon from type 1 to type 3 collagen, kind of ends up looking more of like a cooked spaghetti. The fibers also become thinner and more disorganized, and there's an increase of blood vessels and nerves in the area. Sometimes with chronic tendon injuries, people will see what looks like swelling in the area, but that swelling is actually an increased water content in the structure of the tendon. Tendinopathy is an injury to the tendon that does not involve a full rupture, and it generally occurs because the tendon is not able to adapt to the load that is placed on it. Treatment for tendinopathy is mainly about controlling the load put through the tendon. Rest can only get someone so far, because if there is a tendon injury and someone is resting and then they start to go back to their activities, there's often an overload of that tendon again, which can cause symptoms to return. On the other end of the spectrum, if you continue to overload a tendon, then it also will not help it to improve. Where we want to work with load is in the middle, which is what we call homeostasis, where the amount of load placed on the tendon is enough that the tendon is staying healthy, but it is also not overloaded. Just above that homeostasis part is what we call adaptive homeostasis, where we are slightly overloading that tendon enough that we are increasing those properties of the tendon. We are helping it to heal, we are helping it to get stronger, but we are not doing so much that it is too much for that tendon to handle. When we are doing exercises with someone to help load the tendon, we are also looking at the pain or the symptoms that they are experiencing with that exercise. Sometimes pain during the exercises is okay. We're loading the tendon, so it's normal that you are going to feel it. What we don't want to happen is for that pain to get worse after doing them, or for someone's pain to be worse off the next day, because that shows that that tendon is not adapting to the exercise that we've done. Overall, tendinopathies can be difficult injuries to heal because it's very easy to do too much or too little. With exercise, we want to make sure that we are loading that tendon the correct amount and making sure that the exercises are appropriate for the person's stage of healing.